Okay, awesome. Yes. So hello and welcome. I have Dr. Lindsay Paskowski here. Did I say it right?
Yeah, Pachkowski. Yep.
Paskowski. Okay, I love it. So Dr. Lindsay Paskowski is a physical therapist specializing in pelvic health. And she's here today with us, and I want to welcome her. And she's going to be talking about pelvic floor and what the pelvic floor, how important it is to us, and how important it is for women to prevent any pain or discomfort that comes with changes in hormone, also postnatal after giving birth, and then as we throughout our aging process, basically. So tell us a little bit more about the pelvic floor.
Perfect. Yeah, thanks for having me on here, Sydney. So the pelvic floor, it's a group of muscles that sit at the base of our pelvis. So I know we're doing a video too, but I have my little model here too. Sometimes it helps with explaining. But so there's 3 layers to the pelvic floor. And when you think about that, that's kind of cool because we think about the pelvic floor. Some people think it's just one muscle. It's actually a group of muscles. There's 3 layers to the pelvic floor, and they help support our pelvic organs. They help with continence control, so being able to hold in pee and poop. When we're ready to empty, letting them go, and then having a role in sexual function and childbirth. So I like to explain kind of there's 5 functions of the pelvic floor. So stability, so it's helping with stabilizing. There's lots of other joints connecting between those areas and other structures like ligaments and tendons in the pelvis and in the pelvic floor. So it's stability for our core. It's also supportive. So it's supporting our pelvic organs. You're thinking about all those organs that are sitting in this area of the body and our pelvis. And then also for sexual function, like I mentioned, sphincteric, so opening and closing of sphincters. And it also works as kind of like a sump pump, where it helps with some of that like venous and lymphatic kind of pumping through, getting blood flow circulating and helping with that. So that's kind of a very quick overview of the pelvic floor. A lot of the muscles in that deepest layer are actually hip rotators as well. So sometimes we'll probably touch on some of the pelvic pain stuff, but sometimes those symptoms of hip pain or back pain can actually be stemming from pelvic floor origin as well.
That's great. That's excellent. So when somebody have a pelvic floor issue, what would a physical therapist help with?
Yeah, great question. So physical therapists that are specialized in more pelvic floor specific treatment or pelvic rehab, we help with a lot of different things. It just depends on kind of what people are coming with, but the specialty focuses on pelvic health. So if there's any dysfunction with bowel, bladder, sexual health, or if there's any pain, they can help address that through exercise, behavioral strategies, manual therapy, education, and like functional retraining. So helping people first even connect with where their pelvic floor is a big part of what we at least initially start with. And then depending on kind of what dysfunction or symptom that they're experiencing, we're able to tease through and kind of find out what that root cause is. It might be something in the pelvic floor, it might not be, but we have training to kind of dissect that a little bit more. And then specifically just incorporating the pelvic floor within our core system, because it's really works in conjunction with the rest of our kind of functional dynamic core system of abdominals and diaphragm, and then the pelvic floor and some other muscles within the back. So with pelvic PT, we definitely just kind of, at least I've found that it's more of a holistic approach to PT because there's so many components. When you think about more of the like bowel, bladder, sexual health, there's so many components that we address that can play a role in symptom management as well for the treatment.
Excellent. And so for me in my office, I do acupuncture for postnatal after delivery of baby. And in terms of the pelvic health, what can you offer to help them in this category of women?
Yeah, so postpartum is One of my favorites. I love working with women postpartum. Specifically, I love the return to exercise aspect, but there's a large piece of retraining core specifically after having a baby, and then also incorporating the pelvic floor within that. As pelvic therapists, we have more training in some manual treatments that can be done internally or externally, depending on symptoms. Again, it's kind of person dependent, but pelvic pain, sometimes we'll do some manual work to help with that. A lot of women after childbirth might have pain if they had any like episiotomies or things like that, or if they had any potential injury to like the tailbone or anything like that. That's a great place to kind of that toolbox that we have as therapists to help. So in conjunction with like acupuncture, when someone is getting that, there's also the ability to do manual muscle releases as well, and training for that. And usually I like to empower the women that come in that, you know, I'll be able to do it manually to them, obviously with consent, but then teaching them strategies to do that at home if it's something that's reoccurring. And then also to identify, why is it recurring? Why does it, you know, why does that muscle continue to have more tension or hold more, what we'd say like a hypertone, and having those trigger points? Because it's usually in response to something else that those muscles are responding in that way too.
Yeah, so I have one patient here previously that came in, and she said, you know, when I sneeze, I pee my pants. That's after delivering a baby, you know, after 6 weeks. Or they say I'm walking and then, you know, suddenly I feel like I need to pee, but, you know, I can't pee. So some issues like that could come up after having a baby too, right?
Yes, absolutely. And there's so many kind of contributing factors, which, so we ask, you know, we want to ask about how their pregnancy was, how was labor and delivery, the length of time that they were potentially pushing during labor can play a role, how things were afterwards. Again, if they had any episiotomies or if they had a C-section versus vaginal delivery, all of those play a role in how the women are going to be healing after in that postpartum phase. And a lot of the tissue have been lengthened because, again, baby has been growing there for 9 months. And so those muscles in the pelvic floor already are getting lengthened with the added weight from the baby, but also through the actual labor and delivery, they also can kind of get lengthened too, and with the different hormones. So then that's where a lot of women will experience some incontinence postpartum, and that's something that definitely can be addressed. And it's unfortunately common for some women, but it's not a normal thing. It's still a dysfunction of the pelvic floor. So I work with a lot of women postpartum that have urinary stress incontinence, which would be like with the coughing, sneezing, laughing, lifting, walking, running, all of those types of things. That's definitely a big thing that can be treated and can be really promising results for people that work with a pelvic health therapist to kind of address those symptoms.
Excellent. And so as we talk about as we age, when we get to premenopause kind of timeline, do you see also the hormone changes creating pelvic floor change as well?
Yes, yeah, it's actually interesting. So for a lot of women postpartum, their pelvic floor tissues will mimic them of a like menopausal woman, of thinning of the tissues because of the lower estrogen. So they're not as plump, I guess, if you think about like the tissue. And so when you think about if they're having more leaking, the muscles that are meant to close and open the sphincters, if they're trying to close and they're not as like robust and like plump tissue and they're thinner, when they try to close the opening, there's actually more opportunity for them to not fully close because they just don't have as much of that kind of girth of the tissue. So it's like it's thinner. So it's very, very typical to see that. So depending on, some doctors will kind of prescribe different estrogen creams or different things as well, or just trying to eat certain ways to kind of facilitate more estrogen to that area specifically. And I know some practitioners are doing some injections of Botox, and some of them are doing some other types of treatment, but I haven't seen much specific research on kind of like long-term outcomes with that. But there are some things out there too, but a lot of the behavioral training side of it and the awareness of the pelvic floor can help as well, that sometimes we just have to retrain the brain and those muscles. And then if we have something to kind of like add in with it of plumping the tissues, whether that's something that you're eating or doing that can help facilitate that, that can help.
Okay, excellent. So for instance, much more serious conditions like IC, interstitial cystitis, or herpes, recovering from that, would the pelvic floor program with the PT help to retrain the muscles as well in conjunction with, of course, conventional medical intervention?
Yeah, there's definitely, it escapes me the specific research article, but that they were going through the different types of treatments specifically for IC, and pelvic therapy was one of the best approaches for symptom management, especially on that like initial kind of awareness of different things, and a lot on the education side of things. That for specifically with interstitial cystitis, a lot of it is addressing what certain symptoms that you have and addressing what triggers create those symptoms. A lot of it is related to stress management, and nutrition is a big part of that. And in addition to being able to kind of have good control of your pelvic floor muscles, because like we said, they're a group of muscle, they're skeletal muscle. So they're just like you think about your biceps or your glutes or your quads, they're the same type of muscle tissue. So they can contract, relax, and they're for strength, endurance, power, coordination. So if we are constantly either contracting those muscles or constantly relaxing those muscles, or if they have like that higher tone, that can play a role in symptoms and function too, if they're constantly in a certain state of lengthening or shortening as well. But yeah, PT can help with that for sure, in conjunction with some of the other things. Yeah.
Yes. Okay, that's excellent. So for mention something about either we can do more of an invasive approach or an external approach to work with the muscle as well. So how do you differentiate when do a person needs either the invasive or more of an external approach?
Yeah, great question. Usually for my evaluations, if I have someone coming in, if they're postpartum, making sure that they're cleared by their doctor. So at least 6 weeks usually, just to be kind of on the safe side, just making sure that their body has recovered to a certain amount. But it's a great time to check for prolapse and some of those other kind of underlying things that could be there. But to decide whether or not to, if the patient and client is consenting and okay with it, I will do an internal assessment, because it really is the analogy of washing the windows from the outside and the inside. So you're checking things internally, because there's so many muscles within that deep layer of the pelvic floor that if we're not able to address that, if someone's coming with hip pain, back pain, pelvic pain, I'm pretty confident that there's some component with the pelvic floor there. And I think also it can help people reconnect back to that area of the pelvic floor. It's very common for people to dissociate between kind of the core and pelvis a little bit. And so being able to like realize that sometimes there's muscles that are referring pain. And so that would be like a trigger point or something in some of the pelvic floor. And I'll be doing some of the internal work, which is just with one finger, and I'm wearing a glove and I have some lube. It's really like, it's not like a gynecological exam. It's very different in that regard. But we'll find that there's a muscle that is referring their pain, and they're like, that was my hip pain. And you're like, oh, okay, well, I'm in, like the third layer of your pelvic floor. I'm on this muscle, and this, maybe that's why all of the other things you were doing weren't working, because they were working on more of that external component.
Right.
So there's that internal component. So I try to check with everyone if I'm able to do an internal assessment. Obviously, if someone is not comfortable, I'm not going to be making them, having them do that, but I will, educate them on what is kind of what we'd be doing, what I'm looking for, what I'm assessing. And I'm talking throughout the assessment, checking in with them, making sure that they're okay, and knowing that it's giving us information. And then externally still checking things too, because I'm looking at how well you can contract and relax those muscles, and that coordination piece where sometimes the leaking with incontinence, that's actually something with more motor control, that if that motor control kind of feedback loop is not functioning as well or as efficiently, that can lead to some of those stress incontinence things as well. So I'm screening for a lot of things. I'm checking for those prolapse symptoms, and before doing any of the internal or external, I'm doing a pretty thorough subjective of, asking more about what symptoms people are showing so that we can guide the actual hands-on assessment to give more context to, oh, you said you mentioned you felt like there was, you felt like you had something in the way when you're like going to the bathroom or different things. And then we might find that there's, mild prolapse or something like that, which then connects the dots a little bit more. And then it can provide clients and myself with a better awareness and a better idea holistically of what our game plan is moving forward, so that we can better help kind of address the symptoms and empower them, knowing that there is something that we can do about it.
Excellent. So for your recommendation, how early in terms of treatment is much more important. As you know, in acupuncture, if you do have some condition that shows up acutely, I usually recommend, hey, take care of it right away, because if you wait 6 months down the road, a year down the road, you lose that whole time frame to heal fast. Would that be the case for also pelvic floor also, that you need to tackle the problem sooner than later?
Yeah, I think that rule of thumb in general, whether it's pelvic floor specific or if it's any type of joint pain, musculoskeletal like injury or anything like that, you want to address it as soon as possible. It's not worth, like, quality of life wise, to let it just keep going and keep coming up and limiting you. And also just like for the function standpoint, if we're having if we're going back to that urinary incontinence type of example, if you're continually doing that besides the fact and the bummer of like leaking all the time, it's also a dysfunction within your core, like stability and strength. So that can impact your like spine stability. So if you're thinking about your back health, it can become a contributing factor to other things down the road. And how we were talking about kind of that core system of the pelvic floor is the bottom. We have our diaphragm at the top, our deep abdominals and the muscles within the back. It's like this giant canister. And if we have one area that's not, doing its job, it's dysfunction. And for people that are having that kind of urinary incontinence, that's where the dysfunction is showing up, or that's that symptom of the dysfunction. And so then we have to learn how to strengthen the core, including pelvic floor and core and all of those breathing and all of that goes into it. So yeah, back to your question, I would say the sooner the better for addressing your symptoms, even just getting something checked out, and just to see, so some main like things that would be symptoms of a possible pelvic floor dysfunction are leaking with urine or with feces, having difficulty going to the bathroom, like going poop, like constipation, painful intercourse, pelvic pain, low back pain, hip pain, or feeling some of that heaviness or pressure or bulging in the low pelvis area. Those are some common ones. And then also thinking about at the abdomen too, if there's any of the like diastasis recti. So sometimes that thinning of the abdominal tissue, where some people will see some of that coning or doming with certain movements, that again, we're looking at the core system, but that affects our pelvic floor and where all of those things work together. So there's definitely different signs and symptoms of pelvic floor dysfunction or other things that aren't in the pelvis that can still be a contributing factor. So addressing that sooner is better just long-term for general your health, longevity, and and strategies to kind of empower and know what to do when those things come up.
Excellent. Thank you for that. So I know not all therapists are trained to do pelvic floor exercise or therapy. So what kind of extra training do you have to go through?
Yeah, so for being more like the pelvic physical therapy kind of rehab side of things, I know in some of the schools now, they're like, we had one unit on kind of like pelvic floor, women's health stuff. And so a lot of physical therapists have at least been exposed to what it is. But then to go further into training, it's after you've received your doctoral degree in physical therapy, you do a continuing education. And there's kind of two routes that you can take right now. So the APTA, the American Physical Therapy Association, has their women's health section. And then there's also the Herman and Wallace Pelvic Rehab Institute. And so I've done my training through Herman and Wallace. So they have a whole bunch of courses, but they have specifically kind of like three main like pelvic floor, intro to pelvic floor, and they're looking at female and male and all of those things on the internal assessment and all of that. They both have exams as well that if you want to be completely certified, and I'm kind of in the process of working towards those and pursuing them, but it just takes more like clinical hours and experience within those, as well as kind of just to see within that. But it also depends on kind of what specialty, if you're looking further down a certain diagnosis or different things. But in general, if someone's looking for a pelvic floor physical therapist, I think it's like pelvicrehab.com. I can send you over the link later for specifics if someone's looking for a pelvic floor physical therapist.
Yes, no
because
problem.
that's.
But the thing is, the extra training is on top of the doctorate program. And,
yes.
APTA, I understand they focus on women's health. So that could be a link to start looking for somebody who works in.
Yes, absolutely. Yeah. So kind of seeing where their training was from, or kind of what specifically kind of where their specialty and school of thought is within that. Yeah.
Excellent. Thank you. So yes, so thank you so much. So I understand that you practice here in North County, San Diego. Tell me a little bit about where you are, and then where we can find you. And if you want to have share some resources for us, that will be much very happy to have you to do that too.
Yeah, absolutely. So I work at Inside Out Strength and Performance. We're in Carlsbad, California, and it's my husband and I own our practice, and we love it. We treat and work with active adults, and our goal is to allow people to learn how to live confidently and strong in their life and their active lifestyle. So I specifically do a lot more of the women's health side of things, and also that return to exercise, return to running postpartum specifically, and then a lot of other like exercise movement-based specific training. And then my husband does more of like strength and conditioning in addition to the other PT as well, because he's also a physical therapist. So that's where we are. We're in, Carlsbad. And you can find me on Instagram at Postpartum Performance, all one word. Facebook, we're on Inside Out Strength and Performance. Our website, iostrengthandperformance.com. But yeah, if anyone has any questions specifically, they can always email me too, or reach out on Instagram. But I'd love to share with you, we're going to have you include with our free PDF, we have our Inside Out Strong Living Health and Wellness Roadmap. And it takes you through kind of the main key aspects of health. So we're looking at movement, sleep, nutrition, stress management. And for overall health, that is fantastic, as well as with pelvic health. There's a lot of components within our education piece of the pelvic health treatment that can be applied through that roadmap. And then, I can even send over some other blog specific stuff that we have too that are specific on our women's health.
That's great.
Return to running.
Excellent. Yeah. So I'll put them all the right now on the show notes so that everybody can access to it too once this podcast is posted. So thank you so much for your time. I so appreciate you coming in today and sharing us your wisdom and all the good information on pelvic health. and how as women, this is an important subject because we all go through changes, our hormone change, and pelvic floor as well will change also as we go along our life. And any last minutes tip that you'd like to share with us before we?
Oh, well, thanks for having me. Little mini tip, I'm going to teach you guys the knack. So if you have leaking with coughing, sneezing, laughing, lifting, the knack is basically a way to do a really strong pelvic floor contraction prior to that activity. So if you're about to cough, to do a really strong pelvic floor contraction or a Kegel, before that, it's kind of like a warm-up lap for those muscles to help recruit, to facilitate the closing of those sphincters before that cough, sneeze, or laugh. There's more more beyond that we would take you through if you have with other activities, but that's a great place to start as the knack to give you a little bit of relief for the time being. But yeah, thank you so much for having me, Sydney. This was great.
Thank you. All right, we'll catch up soon. Take care, all right?
Sounds good.
All right, bye for
Bye.
now.